Hey, this is Andy.
And Randy.
And we're here on AT Corner.
Being an athletic trainer comes with ups and downs, and we're here to showcase it all.
Join us as we share our world in sports medicine.
Welcome back to another episode of AT Corner. For this episode, we are going to be talking about, I'm pretty sure this is Sandra's favorite injury to work with.
Yes, absolutely. My least favorite. Any sort of face injury.
That's right. We are talking about the face.
The face. The mouth, the nose, the face. We got some jaw. We got some eyes.
Yep. All the reasons why working baseball is one of your favorite things to do, isn't it? Actually,
I do really enjoy working baseball, but
just not for the risk of face injuries.
Yeah. No thanks. Baseball and softball, that's like the number one thing. That is like the thing for them.
Yeah.
And I'm like, no thanks.
I mean, yeah. MTSS is the bane of my existence.
Oh, face injuries are absolutely the bane of my existence.
So not a big face injury person.
I mean, who is?
Yeah, I don't know.
Who is?
It is kind of weird because it's like, I don't know, someone's face.
The only thing that I will say about face that I do enjoy working with is steri stripping.
Oh, that's true. Also,
which we will talk about later.
Yes. I get what you're saying about like face injuries, because those types of injuries are kind of the ones where if it's bad, it's really bad.
It's bad. You cringe and you're like, I can't make a face right now
because of your face.
I also feel like it's the ones that like people can get over a knee injury, but some people have a really hard time like, this is my face, and they can't see it, and they're like, that's just, it's hard to calm them down. It's hard to get their breath, you know.
And especially like scars on your knees, all right, whatever, but scar on your face, I mean,
yeah, people don't like that.
Yeah, I mean, there's acting gigs that might be out the door now because of that. So limiting opportunities.
I know. I mean, some people see it as a battle scar.
That's true.
I have a baseball athlete who I was like, you want to go get some stitches? And he was like, no way.
No, dog.
This is a badass scar.
Oh.
Like, okay.
Okay.
Sounds good.
But you did such a good job with the steri strips, it's not gonna.
Nah.
So too bad for him.
You want to read the first one? This is about a mouth injury.
Okay,
we can start straight.
The focal point of the face,
right.
The mouth. This one's by Savannah H.
This is like a good starting one. Like, let's get right into it.
I think it also is gonna emphasize how when things go wrong, they go wrong. Mm-hmm. I wanted to share my first traumatic injury that happened during a varsity baseball game.
See?
Baseball.
See?
So the athlete is a junior baseball player during a home game, goes up to bat, and attempts a bunt. I am over at the soccer game adjacent to the baseball field, so I did not get to see the initial contact. But from what sources have shared, he attempted a bunt, which ricocheted straight into the kid's mouth. Which,
I don't know why I didn't think about this before. Like, bunt, you're basically, like, trying to look. So you're basically putting your face right behind the ball.
Yeah.
That was not even now, like, new fear unlocked. Did not even think about bunting as a problem.
I got a call soon after and sped my little golf cart over to the field. The athlete was already out of the dugout with ice on his mouth, moaning and yelling in pain and anger. His injury was covered, but I observed no other injury, and he was stable while walking. Just obviously in a lot of pain. I ran over and grabbed his arm in case he decided to get lightheaded.
Good idea.
That's a really good idea. Sure. And asked him if he was able to walk with me to a place with more privacy. I asked him some yes or no concussion questions and ruled out any other life-threatening conditions. Then I finally asked him to remove the ice from his mouth for me to observe the injury. When I tell you I can still, to this day, remember this sight. He removed the ice and there were no front teeth.
Oh.
Lacerated upper lip, extensive gum damage where his two front teeth had uprooted themselves into the roof of his mouth. That's brutal.
Yeah.
That's brutal. Blood was not pouring from the injury, however. It was very difficult to see what was going on with his teeth. They seemed to have been pushed back all the way into his mouth. My next steps were to figure out where to send the athlete. I prepared myself in case he went into shock and made sure he wasn't spitting blood everywhere.
Seriously.
Thankfully, his parents were there. One of the most important things I remember from my plan of action was to remove him from the scene. The spectators sitting and staring were honestly making the situation really hard for the athlete. Oh, 100%. 100%.
Well, also, like, some baseball diamond, like, my previous baseball diamond was sunken.
Yeah.
So, like, all the spectators can see exactly
everything.
Everything that you're doing.
The school being only 300 students or so, it can be suffocating for such trauma to take place.
Oh, yeah. I didn't even think about that.
I took him over to a secluded area with parents. The AD was calling an oral maxillofacial specialist that he knew personally. Mom was calling the general dentist.
Okay, that's super lucky.
Yeah, we got two professionals on the phone here. That's awesome.
Okay, but what's the likelihood that you know an oral maxillofacial specialist personally?
I know. That's wild.
Okay, sounds good.
The athlete was stable, just in a lot of pain. I was there facilitating the situation and getting ready for any kind of shock or choking incident. In the back of my head, I did think of potential Lefort fracture. Ooh, that's brutal.
So, the only reason I know what a Lefort fracture is because it was one of our Quiz Bowl questions that we got wrong.
Tisk.
And now I know because I got it wrong.
That's true. It's just like I'll never forget Jefferson's fracture for the same thing.
Which one's the Jefferson's fracture?
I believe it's a fracture to C2, and it's like a fracture in like 3 places of C2. So basically, that thing's just unstable.
Bad.
Bad. I made sure to have him let the blood just come out of his mouth rather than swallow it to reduce the risk of him getting nauseous or sick from it.
Also smart.
Kept reassuring him and making sure with yes or no nods whether he was remaining coherent. He was so brave through the whole thing. He was also very upset because he thought he was going to lose his teeth and that his face was going to be messed up. Poor kid.
Yeah.
Especially in high school.
I know.
Poor kid. They were able to get in touch with the oral maxillofacial specialist and drove him out there, 30 minutes away. After hours meant there was no anesthesiologist to put him under.
Shoot.
So they did their best numbing his mouth and resetting the teeth, stitching the gums and upper lip.
Ouch.
He had all this done to his front line of teeth while he was awake. That's wild.
I bet you this kid was like, just please save my face.
Yeah. Well, I mean, I'd pass out.
You'd be out.
So I guess I would be out. He was out of school for about a week. They ended up putting braces on the teeth they had to put back into place, and he was fully recovered in a matter of a month.
That's good.
Yeah, that's awesome. All teeth were intact since they took the bulk of the gums and roots with them when they were pushed back. It was such a specific freak injury with such a great outcome. The help of the AD, his parents, and the school's connection to family healthcare professionals made the process fast and saved his smile. He continued batting that season with a helmet cage and mouthguard. He is on his senior season of baseball. He chose not to bat this year, but is an awesome outfielder.
That's awesome.
Yeah, that's crazy.
Yeah.
The week following the incident, I just racked my brain on what I could have done better and questioned whether I had handled the situation correctly.
Which we kind of talked about in our last episode about adrenaline come down.
Yeah.
Like, that's, I mean, your own debrief within yourself.
Oh, 100%. I found that I was doing this for many of my injuries the first year of certification, and that, over time, the second guessing was becoming less and less of an issue. So I encourage you first years that it does get better. Confidence and surety comes with experience. I was also haunted by the grotesque image of the kid's mouth when I first looked at it. Objectively, while a student, I would have thought the image to be cool and interesting. As a practicing AT, it is not something that is inherently gross to me, but more so traumatic in a way that an athlete I care about and have built a rapport with had to undergo such pain and deformity to his mouth. Major injuries hit in a different way when they happen to athletes you work with and have a professional relationship with or friendship with. I talked it through my AD and realized it was handled well, and it really grew my appreciation for the team athletic trainers are so lucky to get to work with, and how lucky I am to have a great team of coworkers and parents to support and be a helping hand in those situations. You never wish them to happen per se, but traumatic injuries really do grow you as a professional, and I encourage everyone to be brave and confident through them. 100%.
Wasn't that a good one to start with?
I thought it was, yes.
Also,
it really highlights where this episode's going too, by the way.
The teeth. in the roof of his mouth.
Yeah, that's...
And just blood.
I feel bad for the kid because no anesthesiologist.
Dude.
Like, at what point are you like, oh, wait, we're being serious. Like, I'm not going to be put under.
Right.
Like, we're just going to go.
But at what point, like, you're in pain for so long that you're just like...
Well, yeah, I'm sure it was just like, let's just get this done. And I bet them numbing it as best they can. I mean...
Right.
I mean, you have just, like, a little bit of numbing stuff in your mouth, and it shuts down, like, a whole quadrant. So, I mean, I'm sure they were pretty aggressive on making sure this kid was numb. So, it probably wasn't the most comfortable, but I bet...
Right. A lot of pressure. And
yeah.
I mean, they say, like, when we went to the dentist talk at NATA, which was so great, by the way, they said, like, if the teeth and the gums are pushed back, you should put them back.
That's crazy. That's cool.
I know that one got me. I was like, oh, like, I get a tooth, like, you know, you're supposed to put it back in its place and put gauze, but like the whole gums.
Yeah, just put that back.
Yeah, just put that back.
Yeah, let me just... Gotcha, buddy.
Yeah.
Yeah, stereo strip that bad boy. See, that's the hard part. Is like, because you can't put anything in there.
Right. Right.
You can't do Dermabond.
I have a tube of skin lube that in my kit that I use for, and I put in some in a contact solution that whenever someone's just bleeding, not like this, obviously.
Yeah,
but like just a little bit of
the Vaseline won't help on that one.
Yeah, I mean that's the only thing that will stick in a mouth.
Yeah, that's true.
So I'll just like take a glove and I have my little contacts case. Yeah. And then because it's basically waterproof. Yeah. Or watertight.
Well, you know, my basketball team just loves to be bloody. It's like I'm working freaking boxing. Like they'll come to the bench on timeout. I'm sitting here with my glove, putting their the skin lube on their lips or like whatever, like their hand, their shooting hand that has a little scratch. Like let's, because you can't really put anything on their shooting hand. So I'm like, yeah, let's put this. It'll cover it up and look nice.
I'm like, as long as you're not bleeding.
Yeah.
Do you use Blood Stop?
I need to.
I want
to try it. I heard it's great. I heard it works really well.
You just have to be careful when you take it off. It has to be wet.
Ooh, okay.
It says that on the package, but some people forget, and then they take it off, and then it starts bleeding again.
And I was gonna say, you just like you're in the moment. Just all right, let's just take it off.
Yep.
Like that.
Yeah, just like that. Do you have any mouth injury stories?
Nothing crazy.
I've seen a basketball player get elbowed and his tooth was just dangling.
I had an athlete in the weight room. I can't remember what they did, but they hit their tooth on the bar.
Oh.
And like cracked their tooth.
Oh.
Like they did some solid damage to their tooth. Like it didn't come off or anything, but it definitely cracked it. So yeah, we had to send him to the dentist.
So I had this is so unrelated to athletic training, kind of. It was actually a family friend. She sucked her thumb a lot when she was young, and it was like to the point that her teeth shape were like moving.
Oh wow!
And so the dentist was like, "You need to get her to stop her like sucking her thumb." Yeah. And like nothing they tried, like substitution, like nothing they tried, like she would not stop sucking her thumb. But she walked behind someone swinging a baseball bat, and it hit her in the face, and it pushed all of her the front teeth back, and it hurt obviously while it was healing enough that she stopped sucking her thumb. Yeah. And then they didn't have to.
Wild.
And it stopped it like changed the growth of like her teeth were facing forward before, but then like it kind of like put them back of where they were supposed to be. So kind of crazy.
Yeah, that's wild.
Yeah. So this next one is another tooth.
Ooh, okay.
This one's anonymous. And of course it is another baseball.
Oh, of course.
First day of JV baseball practice and first high school baseball practice for this athlete. He was playing outfield and caught the ball. With his face.
That's not the goal. Yeah, that's not the goal when you're out there.
Well, you know what's funny about this is I'm so worried about the batters, never thinking about, like, when I think of outfield, I think of, like, collision.
Yeah.
I don't think of, like, catching the ball with your face.
There is nothing worse than the ball coming up and hitting you.
Yeah.
I've had that on the infield, right? You're taking a ground ball and you're all of a sudden ball takes that one bad hop and you're talking to the ball. tasting the ball.
Ouch.
Yeah.
And baseballs are not forgiving.
No.
Anyway, this person continues on. When I first looked at him, there was so much blood I couldn't tell what was going on.
Love that.
Once I got it somewhat cleaned up, I saw that his lip was very swollen, had a pretty deep laceration on the bottom outside lip, and a puncture wound on the inside from his tooth cutting his lip.
Oof.
Almost got a free piercing out of that one. His bottom front teeth were also smashed in a bit from where the ball hit and his gums were bleeding. I felt so bad for him because he kept trying to talk to me, but I couldn't understand what he was saying. We both got a good laugh out of that later.
Oh, of course.
The first thing I did was stop the bleeding on his lip so I could get a better assessment of what was going on. Then I saw his teeth and gums. Surprisingly, they were just barely loose and otherwise secure, so I just tried to stop the bleeding on his gums as best we could. I rolled up small pieces of gauze and tucked it inside his bottom lip, and then put gauze on the outside of his lip and applied pressure. So basically sandwiched his bottom lip in gauze. Then I cleaned up the blood that had gotten everywhere else on his face, hands, and new shoes.
Oh, that's the worst.
He was a tough kid and stayed pretty calm, which helped a lot. I called his parents and referred him to the ER for stitches because our local urgent care doesn't provide stitches.
Interesting.
That's good to know.
Yeah, that's interesting.
Like if whatever's around you, like where are you going to send them?
Yeah.
And of course told him he needed to see his dentist as soon as possible. Thankfully, he was okay after a few stitches and a trip to the dentist. He was able to return in a couple of weeks after his teeth and stitches had healed overall. Had a pretty good rest of the season.
Nice.
I'm glad he wasn't afraid to play after that. He was ready to go back before his stitches and teeth were.
Of course.
That is good because you know they talk about like kinesiophobia and like fear of going back.
I'm definitely afraid of the ball.
Did you get hit?
Yeah. As a kid, yeah. Got hit in the back.
Terrified
me from there on out.
Yeah, no thanks.
Also, I don't do great with pain, apparently.
No, apparently.
Oh, man.
I know they have the American, what is it? The American Sports, the Academy of Sports Dentistry. They have like those tooth handouts, and then they also have the NATA has a position statement.
Yep, on dental injuries.
Which is good to review. We should do that one.
I've got it in there. It's in the rotation.
We got to do that one before basketball season. Because that's probably the next. I mean, maybe we'll baseball and softball, summer. But maybe
give people something to think about over the summer.
Yeah.
Sorry, I don't know why that story reminded me, but I was thinking of the stitches, right? And like some of the stuff that gets sent to like the hospital and stuff for stitches. Mm-hmm. Like it was literally just the other day we were talking about this about one of our athletes who was like in a car accident and like his hand was pretty jacked up. Like this was an old injury. Mm-hmm. But like we saw the pictures of what it looked like after the accident, and it's like, man, like when you get something like that in the hospital, like as the clinician, like getting ready to do the stitches, like some of those injuries are so bad. It's like, where do you start? Yeah. Like, okay, where am I going to start my stitches? Like, how am I going to get going here?
Right.
Like that's wild.
Well, also, sometimes they need to do like deep stitches and then like some superficial
like the different layers. Mm-hmm. Yeah, that it didn't even. See, that's another thing. So, like, I was just thinking about that, and we were talking about. It's just like, man, like you look at this and like, all right, where am I going to start?
Right.
What's the first thing we got to get done?
So this next one is from Valerie A.
Perfect.
So you know how we were talking about collisions in outfield?
Yes.
This is a collision injury, but it's not baseball.
Okay.
Yes. And they're both face things. I think, if I remember correctly.
Wow, 2 birds, 1 stone, huh?
I know. So this one's from Valerie A. Classic girls basketball drill where 2 freshman girls were running to get the ball at center court. Both athletes collided and hit heads. Athlete A's head hit athlete B in her face. Oh. Isn't that a great collision?
Of course.
Athlete B had a displaced nasal fracture.
Oh, super.
Went into shock while trying to control the bleeding from both nostrils, as well as a laceration on the bridge of her nose. She was transported due to the shock, as well as inability to control the bleeding, and had surgery the next day to repair the deviated septum. The nose was flattened to her head, significantly displaced and deformed. She did not return back to play that season, but became a very good track star afterwards.
Nice.
When athlete B hit athlete A, her tooth went into the scalp of athlete A. She also needed medical attention, but no staple needed. Blood everywhere. Worst nasal fracture I'd ever dealt.
Yeah, man. Athlete B sounds like they got crushed.
Dude. I mean, both of them.
Yeah.
A tooth in the scalp.
A tooth in your scalp.
And just any time that you have to control a lot of bleeding. And the faces and heads, those things bleed. Mouths,
you know what?
Bleed.
I had literally this past women's basketball season, I had a situation just like this during a game. My girl and the opposing girl in a game knocked heads. And like, so it happened, right? So I saw it. I'm already starting to walk on the court. And all of a sudden, I saw like the blood slowly starting to come down.
Oh no.
And I'm like, okay, well, we're going to get there. And so I'm approaching her, and all of a sudden, I knew this was going to happen. Her hand went down. More blood started pouring. She looked at her hand.
Oh no.
Immediate tears.
Oh,
I'm like,
no.
I'm like, crap. Oh. So I rush over there. I cover it, and I get her to the bench. Oh, yeah. Safe to say, she definitely needed a couple staples.
Yeah, you know what? They usually staple heads, huh?
Yeah.
Or like scalp.
Yeah. Luckily for this one, it was more in her hair.
Oh, that's good.
So it was like, okay, cool. Like, it's not as sensitive, like, of a situation like the front of her face. But yeah, that one took a little, like, that one actually, for like a facial injury, her bleeding was pretty easy to control.
Have you ever had to use their hair to help? Like,
so I had a student with me, and like, so I controlled the bleeding, and I'm like, dude, you need to go get stitches. Like, well, let's go.
Because you can't steri-strip.
I can't steri-strip it. And she asked, like, hey, what about like trying to use her hair as the? And I'm like, look, you can, and I know clinicians that do, but I'm like, there's a lot going on here. I'm not going to try and sit here trying to tie her hair. Like, I packed her. She's going to go get stitches. So yes, it is an option. It's just not something that like. I feel like I'm going to take more time trying to do that.
It's all those fine motor skills.
Yeah. So I was just like, you know what? For me, my better option, I controlled the bleed. Let's just get the staples in.
Right. So I mean, you have a time frame. You can let them, like, if they're not like absolutely. Yeah. I had a men's basketball athlete who had a laceration right behind like his left ear, I think.
Yeah.
Not like right behind, but like a couple inches where it was in the hair.
Yeah.
And his hair was like long enough that I could tie like a little knot, and then I put gauze on top, and then I gave him a headband, a Powerflex headband.
Yeah.
And then as long as the bleeding was controlled, he kept going, and then I was like, you might want to get that stapled.
Yep, 100%.
Because I can't do anything else for you. Yep. I can't close that. Although you could probably glue it.
Yes. If you have like a Dermabond, I do have a Dermabond, which it probably is expired by now. But like,
I had a Dermabond, but it's expired.
I have it, right? And I'm not going to just use it willy-nilly. Like, you need to use it on like, this is the time for Dermabond. So I didn't want to.
But then you're never, and that's how they get expired.
Quote unquote. I didn't want to waste it.
Right.
On just other things. So I'm like, oh, I'm going to save it. And now we're probably looking at an expired one.
Yeah, I don't even know where mine is because it's expired. I probably threw it away.
Oh, I got it in the kit. I'm actually getting ready to use it on our Normatec. Oh. Well, it's expired, so I'm like, man, I don't know if it's going to work on a human being.
Right, that's funny.
And I have a Normatec that's leaking air, so I'm like, hey, why don't we just see if this works?
Yeah. Okay.
But then it's like, I'm using Dermabond to do this, and that's not cheap.
No, it's not cheap at all. I'd be scared to use Dermabond because I've never used it before. I feel like I need to watch it first.
Used it once.
Did it work?
It was alright. I mean, that could have been user error, but it was alright.
Yeah. Okay, this next one is about a nose and a face.
Alright, this one's by Anonymous. I had an athlete take a fastball to the face. Oh, it's a great start.
Guess what? We're back.
We thought it had hit his helmet, but when he stood up, we saw the blood and realized it was his face. Got him into the dugout, and his nose was an S shape. We couldn't get the bleeding under control, so we sent him to the ER ASAP with a towel for him to hold his nose. Later found out his nasal bone was broken in 2 places, orbital and zygomatic. It was crazy. He had plastic surgery a week later and had a plate put in. And by a week post-op, 2 weeks after the injury, he had some swelling, but looked almost the same as he did pre-injury.
That's pretty good.
Yeah, that's pretty good. I still think it's a little trippy to have a plate in your face. like, again, maybe it's just the face thing, because like, right, plates in like other areas, whatever, but like, I don't know, plate in your face, that feels weird. It feels weird to say that.
I think that being like, we say like, oh, a week, 2 weeks, like that's not too bad, but like when you're in it, that seems like forever.
100%. That's true.
Like, could you imagine your face being broken for a week?
Yeah, and you know, you're probably still in some sort of discomfort,
right,
around that. It
doesn't just go away.
Yeah, just because now we have a management plan doesn't mean that you're feeling better.
Right. You know, I was thinking, because like noses bleed, and especially
yes, they do.
Yes, they do. Especially like if you have a fracture, you need to have a backup plan to. Well, I need to have a backup plan to my nosebleed. Management plan.
Your magic,
because I use that voodoo magic trick, the stomp heel 3 times.
You know, like I've yet to use it.
I use it every single time. There's only one time that it hasn't worked.
What if it doesn't work and I just made them look weird?
Then you use your other magic management plan. It literally works so fast. Like, it coagulates so fast.
How?
Don't ask me. I said it's magic. But then I was thinking about this, and I was like, man, if I'm thinking like if someone just got hit in the face of the ball, like, I am not gonna.
Hey, why don't you stop?
I'm not gonna hit their heel like really hard. I feel like that vibration of the whole body is probably like, no, they're never gonna let me touch them again.
Excuse me?
I know.
What do you want me to do?
And then also my backup plan to that would be like, putting a nose plug. I don't put the nose plug in the nose, because when you take it out, it's just gonna like start bleeding again. Yeah. Because you're basically just tearing that tissue again. Yeah. But if you take a nose plug and put it under like the top lip and then press on that, like, that's another coagulation point. Mm-hmm. So, but if you have like a Lefort fracture and their nose is bleeding because they got hit in the nose and the like front of their maxilla,
you're hanging on
like that. Now I need a third backup plan to stop this nose bleeding.
Yeah.
What is your management plan for nosebleeds?
I mean, just kind of like what you kind of stated. Nose plug. I'll do when I put a nose plug in, I'll lube it up.
Lube it.
Yep, and then I shove it into their nose. If it's not like a significant bleed, usually that'll kind of clear it up, because usually I put it in there, I have it in their nose, and I tell them like, hey, push it up as far as you can, and usually by that time they already need to be cleaned up. So while that's in there, I'm cleaning them up, you know, either the jersey or the hands, you know, trying to get all the blood off of them. And usually if it's a minor bleed, usually around that time, like, the nose plug looks pretty good, they're not bleeding anymore. If it's taking a bit longer, I'll do that. I'll do the nose plug under the mouth too, or under the top lip. Mm-hmm. If we're really having a problem, then I'll go ice to the nose. Mm. But very rarely have I had to actually get to like, hey, let's throw ice on this kid.
Actually, I'm surprised it didn't bleed. I had a baseball kid, our first game this one of my past seasons, that he took a pitch straight to the nose. Ooh. But the only thing that saved him was he was wearing a helmet with a C-flap, like the cheek. Uh-huh. And I ran out there, and of course, like, I only started working baseball like 2 years ago. So, and I don't I went 0 to 100, like, don't know anything about baseball, right? And don't know what a C-flap is, right? So I run out there, and he's like, it hit me in my C-flap. And I'm like racking my brain for what the heck is a C-flap? Like, what anatomical term is he like what are we talking about? What kind of new young person jargon am I not understanding? What
Gen Z communication is this?
Right. I was like, what is a C-flap?
This is not a vibe.
Yeah. And so finally I just started like evaluating him, because I was like, I don't know where it hit you. I'm just going to figure it out. And his nose didn't bleed, but... Nice.
And you now know what a C-flap is.
Now I know. It saved him. And I am so grateful for C-flaps.
And now you wonder why no one's wearing them.
Yeah, exactly.
Everyone should wear them.
Yeah.
Or the cage.
He even with the C-flap, he brews so good.
Oh, I bet.
Yeah.
I don't know why more people don't wear the cage. I don't know why that's not like a baseball thing.
I see it in softball.
Yeah, softball does it, but I feel like after like youth baseball, like no one wears it. I'm like, bro, put the cage on, man.
Their egos are too big.
Yeah, that's true. Helmet won't fit if it had the cage in.
I can't even get some of them to wear elbow, like the elbow pads.
The elbow guard.
Like, come on. You're not going to be able to catch. You're not going to be able to throw.
Look, it gives you
elbow.
It gives you a little more surface area to get on base. Come on.
Yeah, seriously. Okay, so this next one's still in the nose. The realm of the nose.
We're staying in the nose. This one's by Brandee B. A girl took a lacrosse ball to the face. It hit just in between her goggles, of course, naturally. It was clear she dislocated her nose. Sent her to Team Doc for x-rays, then referred to specialist. She took a couple of days off, but was able to return to lacrosse once we got a nose guard. She couldn't play lacrosse without a nose guard.
So how does a nose guard work with goggles? Or is that why it's custom?
Ooh. That's true. I haven't thought of the goggle portion. Well, I guess you don't necessarily need the goggles at that point because that is the eye protection too. Because I mean, the mask protects, like it has a rim around the eyes, so it could protect your eyes. That was a good question. Yeah.
I have to deal with. I didn't have lacrosse in my previous school, so now I have to. I have to figure this out.
She couldn't play lacrosse without a nose guard. We got her a custom guard so she could play. Her first few practices eased her in, no high-intensity drills until she felt comfortable. She played for a week or two and then went in for a procedure to reset her nose. She returned to lacrosse afterwards without issues and wore the guard for about 4 weeks. There actually wasn't too much blood. I was able to stop the bleeding quickly, so she just had the deformity. I did not pack her, so just ice. Lacrosse practice was in the morning. She got x-rays within a couple of hours on campus and saw our team physician that afternoon. The dislocation was stable. She got a closed reduction within 2 weeks. Oh, that's awesome.
Mm-hmm. I kind of like the whole progression of it.
Yeah, 100%. The nose guard face mask deal, those are dope. I finally had an athlete who needed one for a nasal fracture. It was pretty cool. Mm-hmm.
I've never had someone who's needed one.
Yeah, it's pretty cool. It's all right.
The only nose, other than the baseball nose, that I can think of off the top of my head was a Brazilian Jiu-Jitsu.
I think I remember you talking about this.
But this one was like so easy because he came off and he was like, "Hey, I'm pretty sure I broke my nose." And then I was like, "Oh, like you could see it, like it looked like a C."
Okay.
And
noses don't do that.
Yeah, exactly. So then I was like, "Oh." And I showed him a mirror, and he was like, "Yeah, no, my nose doesn't look like that." And I was like, "Oh, yeah." And it wasn't bleeding. He could breathe just fine out of both nostrils. It was really simple, like straightforward. So we're like, "Yeah, you're gonna want to go and get that.
You need to get that looked at.
Get that reduced." So this one is a bad softball drill.
Okay.
This one's by Rebecca R. Our softball coach does a drill where he hits the ball above the light so the girls have to find it and react. I've worked here for 5 years, and every year someone gets a ball to the face with either a concussion or a severe contusion.
Oh, okay.
The worst one was one of the catchers who missed the ball and it broke her nose and eye socket.
Holy smokes.
So we're moving up now.
Yeah, we're just creating more trauma.
I was in the athletic training room and she came in with a bloody nose. After we cleaned it up, I had her look in the mirror and she was like, that's not right. For the most part, I let her touch her own face because she was so tender. She was also a nursing student about to graduate, so I talked her through a lot of it, but let her get the experience. She surprisingly wasn't in that much pain, but her pain scale was typically higher than most others. Honestly, most of my softball girls have a very high pain tolerance. Like, currently I have a girl who played all of last season, and now, because she waited so long to go doc, with just chunks of her tibial tuberosity floating around.
Bro, what?
Yeah, I got a weird bunch.
Yeah, it's like my men's basketball team, man. They'll just put things off.
Really?
Even now. We're in like off season, and they just still want to just power through things. I'm like, of course they do, bro. Ball does not have to be life. Also, rehab is a part of ball. Which, if ball's life, you would like do your rehab. I don't understand. LeBron, if you're listening, because obviously we have LeBron listening to AT Corner, please go on ESPN and tell all the basketball athletes how you recover.
Yeah, seriously.
And how you pay attention to rehab.
Seriously. If the pro athletes didn't go to the athletic trainers, then Gary Vitti wouldn't be a household name.
Exactly.
So I sent her for the deformity. She was definitely having trouble breathing through the smooshed nostril. I sent her to urgent care to see what was going on, and they said she had to go for a CT scan since it's facial and didn't want to miss any bone fragments. She ended up fracturing the frontal process of the maxilla, orbital plate of the ethmoid bone, and orbital surface of the maxilla, and obviously deviated septum. She ended up having surgery to fix the deviated septum. Incident occurred in mid-late September. They had to wait to fix the septum until the fractures healed. She had surgery in November and was perfectly fine by January when they started practice. Incredibly enough, even as the catcher, she didn't even flinch when she played.
Wow.
I don't know how. Haha. She was our starting catcher. Luckily, this happened in the fall, although it wasn't great because we, a D3 team, always go play a big D1 at the end of September.
Oh, dang.
So she obviously missed the big D1 game, and Coach was mad.
Hey. I hate to say it, man. I
mean, when Coach threw the ball.
I think the choice of drill with that kind of trend, I don't know.
He and I have a love-hate relationship. That was when we kind of had it out that he can't get mad at me for him doing drills that are dangerous, and when his starters get massive deformities, blame me for it. Yeah. Since then, we've been civil, but we still have our issues. The biggest thing that I learned out of that is if you're ever dealing with the face, don't bother sending them to urgent care. They automatically have to get a CT scan, so just send them to the emergency department. That and also spinal disc herniations. Never go to urgent care. Always emergency department.
Yeah, and you know what? I mean, even with like urgent care, it's hit or miss, you know?
Yeah.
You never know what you're going to get.
Right.
Because you're right. There are bad experiences where they go and they're just like, oh, I can't help you. Well, right. You wasted all that time for them just get, we can't help you.
Right.
So, yeah, I get it.
Oh, that's so frustrating.
Oh, 100%. Which makes it tough for us because it's like I'm trying to send this person to the appropriate place.
Right.
And when you think like, oh, this is the right route, and then they hit the athlete with, oh, no, I can't help you here. It creates so much confusion and frustration for the athlete. It's just like, oh, I was trying to avoid this.
Mm-hmm. So now let's move up again.
We're still moving up, huh?
Going up to the eye.
All right.
This one's anonymous. Actually, you should read this one because it is about pole vault.
Oh, yay. Yay, track.
Your favorite.
Yay, track athletes. Woo! Luckily, I've only dealt with some bleeders that weren't too bad. A learning moment from school makes everything seem minor, though. One of my preceptors shared this story from 2016. So I'm an anxious mess at track meets. Senior college pole vaulter in his last meet to qualify for nationals. First warm-up run, the collar got bumped, so his pole stopped a couple inches short and speared him around his right eye. Lacerated his cheek, shattered the zygomatic and orbital bones. The force knocked him unconscious and separated his skull along the sutures. Excuse me?
That's pretty intense.
Oh my goodness. Wait, what? AT went to stabilize his neck, and the athlete woke up screaming in pain because, his skull was in pieces. So he had to stabilize him by his traps and ended up covered in blood. He kept the jacket.
I think about this sometimes. Like,
what's going to happen to my clothing today?
Yeah. Well, also, I went to do I went to practice a log roll with a football helmet. I was wearing a puffy jacket.
Oh, yeah. I remember you talking about this.
Slippery.
Yeah.
Bad.
Hey,
lost control of the helmet.
That's a fun fact right there.
Good to know. Good tip. Now my go-to jacket that I wear to football.
It's not puffy.
Can't wear it anymore.
Yeah. Ambulance came and got him, stopped the bleeding, hospital cleared him of spinal or brain injury besides concussion. The athlete spent a few days in the ICU, where the meet took place, then was able to fly home for reconstructive surgery. They replaced his orbital socket and zygomatic with prosthetics, and he has to have surgery every few years to keep his eye from drooping.
That's crazy.
That's wild. But otherwise, healed insanely well. He had no lasting effects to his vision or brain function. His surgeon cleared him to return to sport, but the team doctors and AD did not allow him to compete pole vault due to some post-concussive issues. He was able to come back later to pole vault one more time as a sort of get back on the horse and overcome the fear sort of thing. He's now a mechanical engineer and a husband and a father.
Look at that.
That's
Athletes
awesome.
Athletes grow up.
Yep. Life beyond sport.
Life beyond sport.
Yeah. Pole vault can do that to you.
You had some pole vault to the face, right?
I've had it a couple times. There was one when I was a student.
Mm-hmm.
Kind of not necessarily similar, but kind of the same idea. So like a lot of times if a pole vaulter is not comfortable with like the steps or just something's off, they'll bail on their jump. And a lot of times it involves them just running through the mat, right? So they ditch their pole and like run through the mat. A lot of times like you have the idea I'm going to do this and you can let go of your pole as it's dropping and you're fine. Every now and then you get a little unlucky. And we had this, again, this was when I was a student. We had one kid, he was going to bail on his approach, but his pole hit the box and he didn't like push up his pole in time and it went right straight into his forehead.
Shoot.
So the end of his pole just dragged his skin up. Went out there. We were controlling the bleeding. I think he was going into shock, which is why we had to activate EMS.
Could you see his scalp? Could you see his bone?
From what I remember, I think you could kind of. You can kind of see the skull. Like it was a pretty deep laceration. So, packed him up, sent him off, right? The next one is one of my favorites because, you know, when we talk about when you're first certified, that's when things happen to you. This is literally my first job certified. This is my first time being a certified athletic trainer out in the world. I was helping with the pole vault summit. And the first day is always the easiest day because it's like a warm-up day, but it's also an education day for like the younger students there that are just trying to learn pole vault. And they do 2 sessions that day. One session's at the hotel, the next is at the arena. So the hotel session is literally like basics. Like we're just learning how to pole vault. Like it's nothing theoretically bad should happen at the hotel because they're not doing anything that intense. Right. So they cut off these like mock poles. Like it's still kind of like the same pole material, but they're like dummy poles. So you can just, they're not the full poles. So you can just learn the movements. Right. And they were doing this drill where, you know, they just learn how to drop the pole and, you know, how your hands are supposed to push up on the pole and stuff like that. And I don't know what happened. I think the pole got caught in the carpet and this poor girl didn't get her hands up in time and clipped her right on the side of her forehead, like kind of like, I think it was her right side, like kind of the right side of the frontal bone, like in their skull. And again, same thing, kind of like pulled up some of the skin. And luckily, I was assigned to the hotel session that day. Just me hanging out at the hotel. Yep. Nothing was supposed to happen that day. So, controlled the bleeding. You know, I steri stripped her and I told her, okay, like, yeah, you're going to need to go get stitches. So, before they left, you know, mom and dad were there. I told them, hey, like, you know, you guys need to go get stitches because she was like in high school. And I told them, I said, hey, you know, again, this poor girl, right? It's in the middle, like pretty much the middle of her face. I think they had a dance coming up too. Oh, I know, right? So you don't want a giant scar, right? You don't want that. So I was like, hey, when you get to the ER, ask for a plastic surgeon to do the stitches. And they're like, oh, okay. I didn't think they'd seriously do it. Like
why did you think they'd?
I just think, but well, because you know, like when people go, like if you're not super familiar, right? You're just gonna whoever does the stitches, cool. We got the stitches. Let's get out of here. So.
Not on your face.
That's why I recommended it. I just didn't think they'd do it. So I checked in with them later. Like, hey, how's it going? And like, oh, we're still waiting at the ER. They had to call in a plastic surgeon. I'm like, dude, they did it. And I do have to say that she checked in the next day at the pole vault summit, and stitches looked great.
Good.
They looked immaculate.
That's really good.
Yeah, I'm never gonna forget that story because it was one of those welcome to athletic training moments right there.
Mm-hmm. So we got a couple more. We have two. The next two are about jaws.
Dun-dun.
Yeah.
Dun-dun.
This one's by Robyn S.
Sorry, I had to finish it.
Okay. I had a kid make a super normal tackle in football last fall, and he didn't get up very fast after. When I got out to him, he had his helmet off and was spitting out blood. That's never good.
No, that's not good.
He wasn't able to talk when I got to him, so I was immediately concerned about his head, neck, and internal organs. I cleared both of those quick, and then had him smile to check his mouth. His lower teeth were clearly not where they should be.
Excuse me?
So I thought that he had just knocked a few out of place. I got him off the field and sent him to the ER with his dad since he was continuing to bleed from his mouth and still hadn't said more than 2 words, yes and no, since I first got to him. I found out later that night he broke his jaw in like 4 different places, and I had to have his mouth wired shut for 6 weeks.
Yeah.
We reviewed the footage and didn't see anything abnormal during the play. He caught the bottom of his mask on someone's hip, but it was a tackle you see all the time. I still give him crap for it whenever I see him. Hey man, guess how many jaw fractures I had during wrestling? 0. He's a good sport about it.
That's pretty funny.
That is.
Hey, no, that's true. Like a fractured mandible, like you're getting that bad boy wired.
Yeah.
I've seen, it wasn't my athlete, but it was a rugby athlete for like the club sports, and they had a fractured mandible, and yeah, I saw him wired shut, and like he could only really talk like this because like his lips were like, he only had a little bit of room for his lips to move.
Dang.
So he literally was talking pretty much like this.
Wow.
Yeah, it was crazy. Like that's got to be terrible.
So I had a basketball athlete who, it was not my team, it was the visiting team, but I was covering both sides, and I don't remember even what happened. I don't know if he took an elbow. I don't remember. But he was down on the opposite side of the court, and he had his jersey pulled up over his jaw, and I ran out alongside the side of the court, so I wasn't on the court yet. And as soon as I saw it over his mouth, I was like, please, there are 2 things that I don't want to see when he pulls it down. 1, please don't be like super bloody.
Yeah.
And 2, please don't be dislocated.
Yeah. Yeah. 100%.
And it was neither.
Good.
Thank
my goodness.
Wishes were answered that day. So this next one's by Bailey W. She said, kid got put in a headlock without headgear taken to the ground. By the time we got there, we couldn't tell if it was broken or dislocated. Face was swollen. Athlete was going in and out of consciousness. When he was awake, he was in so much pain that he would pass out again. He continued to breathe the whole time through his nose. He would struggle when he would wake up from the swelling in his tongue. That's kind of scary.
Yeah, that's pretty bad.
I think the tricky part of this one was his guardians were not answering the phone. We had already activated our EAP. For EMS, we have determined that I would go with if a guardian wasn't available. Luckily, his mom showed up as we were loading him into the ambulance. Our response time that day was a little slower than normal. The kicker, too, was when he was conscious, trying to keep him controlled because he would start flailing.
Of course.
Once he got to the ER, the jaw was reduced under sedation. After that, the head coach handled the incident reports to the school, and the other ATC handled the injury report.
Nice. Ah, that's crazy.
Right?
That's wild.
And that's what, like, you know, I think in school you prepare for, like, what you see and, like, the signs and symptoms and everything, but they don't as much prepare you for, like, the flailing.
Yeah.
And the calming down and the constant checking in. And, I mean, obviously you're going to get that in, like, your clinical rotations, but so you want to keep moving back up the face? I don't know how we got jaw. We went down again. We got to go back up.
Let's go back on a high note here.
So this one is an orbital blowout fracture.
Ooh, that's a good one.
Yes, and we have pictures for this one.
Yes.
So this one's Sarah G. Orbital blowout fracture from a cheerleader getting an elbow to the eye.
Ouch.
Referred to ER with a bag of ice. She was stable other than pain. She was out that season from stunting and spent about 2 weeks at home. She was embarrassed by the way it looked.
Oh, poor thing.
I couldn't do a movement assessment as she was already swollen shut and didn't want to try to open. Pain was the main indicator and mechanism for referring.
Yeah.
And it was before the days of VOMs. We also treated like a concussion as well to be safe. So, for you, since you can see these.
Oh, poor thing.
There's like a progression. Like you can see like, I don't remember what the first one is, but like you can see the bruising throughout the eye. It's like above and below. It's kind of like stage makeup.
Yeah, 100%. I was gonna say it looks. I don't want to say it looks fake, but like it looks like makeup. Like the colors look so vibrant that you would think like, oh, it's like a paint.
So we'll put that in our Facebook group, which I'm just gonna plug right now. Facebook.com/groups/AT Corner Podcast. If you're not already part of it, you can. There's only one question to get in, and it automatically puts you in because I don't go on Facebook enough to deal with that. So, it will be, we do an episode thread, and then we have this will be in there. Yep. You can post stuff. So
yeah, it's a pretty fun place.
Yeah, so this will be in there, and
along with question of the week.
If you want to share your pictures,
yeah,
it's also in the show notes if you just scroll down. Oh, so speaking of swelling, we also have a creative swelling hack.
Ooh, okay.
Which I think was very fitting for this.
All right.
Because, and this is also something we talk about too, is like, there doesn't always have to be an injury. Like, sometimes it's just swelling.
Yeah, sure.
Like this one, so Angie M said, had a soccer goalie get a nice contusion over the eyebrow, and over the course of tournament, multiple days, the swelling started to limit her vision. Not the eye function, but the eyebrow was. So it was getting in the way of seeing things out the side, which is important for a keeper. We used steri strips to raise the swelling and lift it up so she could see better, and then used a pre-wrap headband to keep the ends down.
Oh, that's so cool.
It worked great.
That's a good call.
Mm-hmm.
That's pretty cool.
I thought that one was creative. And so, like, you get hit, you get swelling, doesn't mean something's torn, doesn't mean that...
Well, you know, this kind of makes me think of KT tape. Like, I don't know if you were watching the Winter Olympics this last cycle. Mm-hmm. The KT tape around the eyes, like for, I think it was like biathlon or like those athletes, that became all the rage and people were wondering what's going on.
What was it for?
I can't remember. But I just remember seeing they had like the octopus KT tape deal where they had certain strips go around the eye. That's what made me think of that. Yeah.
That's kind of cool. Which also leads us into like just steri strips in general.
We love steri strips here.
Well, I did put a poll up.
Okay.
And I asked if people liked steri stripping or if they didn't.
Okay.
And I don't think it was actually like as one-sided as I thought. I kind of thought like everyone liked steri stripping. But let me look it up right now.
I mean, like, I wouldn't mean everyone loves steri stripping.
I don't know. Everyone who I
mean, it's cool, but like, I don't know.
88% yes, 12% no.
That's pretty resounding.
That's more one-sided than I thought, actually. But
I mean, I wouldn't say I love steri stripping. Like, it's cool.
I love steri stripping. Actually, to the point that one time I was
like, "What do you mean you love it?"
I was doing it, and one of my athletes was like,
"Were you smiling?"
I don't know. He's like, "You seem like you like really like steri stripping."
Were you smiling?
I don't know.
Were you like, "All right"?
I was probably like one of those like, you know, like when you first get out of school and you're like super eager. That's probably that's probably the vibe I was giving off.
Yeah, probably.
And it was not even, it was like recent.
Oh, that's funny. That's so funny.
It's like, you look like you enjoy
it's because we enjoy our work.
And I was like, excuse me, this is like the closest I will get to surgery in my setting.
That's fair. Okay, that is why you like it.
And suturing.
Yeah, that's why you like it.
So Sarah S gave us a steri strip tip.
Okay.
She said, tough skin the edges and squeeze the wound together. Then tack and pull one direction for the outer strips, and then for the inner strips, you're going to tack and pull the other direction. Almost like a weave.
Nice. I like it.
Yeah, I thought that was creative.
Yeah.
I'll have to try that for my next
sure.
steri strip. Usually what I do is I take a cotton tipped applicator where it's like one side Q-tip, one side wooden stick, and I spray like Tough Skin or QDA or something like sticky on the cotton tipped applicator side, and then I use that to like just go around, not in, around the wound after I clean it.
Yeah.
And then I take the opposite side, the wooden side, and I put a steri strip on the end, and then I put my thumb on that. And so then I use that, the wooden side, to help pull the steri strip.
That's good,
so I'll tack one side with my thumb, and then I'll pull the other side with the wooden stick and my thumb, and then I'll place it down.
You know, that's kind of what how they manufacture the steri strips. That's kind of what you're supposed to do. Like, you know how it has, like, it's on the paper, but it's a trifold paper, right? Where you can remove one edge.
Uh-huh.
So the idea behind it is you attach one end to the like one side of the wound, and
like
then,
of all the strips at once.
all the strips, and then you have the other side on like a cotton tipped applicator kind of thing, and then you pull them all. So then you can lay down like, what is it, like 4 strips in one.
Wait, what?
Yeah. That's why they make it that way.
So how do you get rid of the middle part of the strip?
Oh, you take that part too.
So why is it a trifold?
So because you do it in parts, right? So you take the one part off, put the edge down, take the middle out, and then you can have it on the cotton tipped applicator, and then as you lay it down, you can flip out that other trifold.
That says it on the box?
I can't remember. I don't know if it says. That's what I heard. That's why they make it that way. Is that's how you're. I don't want to say you're supposed to do it, because obviously each wound's gonna be different.
Right.
But if it's like something where you're adding multiple and it's pretty straightforward, that's why it's like that.
I've never heard of that.
Yeah.
Also, I heard that you're supposed to start from the center. Although I guess if you have like something long enough, I guess.
Well, that's how I start. That's what I was taught.
Right.
You do the center and then you go out.
Right.
Because it's easier to, because if you start on the edge and then you're like, oh wait, my tension's off, then yeah, it's easier to adjust. But again, it goes back to ERs and stitching. If you have something that's like, there's a lot happening, it's like, where do I start? So that's where it goes back to.
Yeah. So I actually have a permission to share the story.
Okay.
Who came to me when it was 2 outs left. So we were hitting.
Yeah, this is amazing.
2 outs. And he comes to me, and his forehead, he has probably a 2 to 2.5 inch laceration on his forehead. And I was like, what?
That's pretty funny.
What do you want me to do right now?
Yeah.
Like, you have to go out there, right?
Yeah. He's about to.
Like, I don't know. Like, this could be like one more batter.
Yeah.
Or it could be a 2 out rally.
Yeah. And you have to just game plan that it's coming right now.
Right. So then I was like, okay, well, I guess I'm going to try and close your wound because it's bleeding.
Yeah.
So I opted for steri strips. I've never steri stripped faster in my life.
Hey, you got him out there.
And I did. I did
got
get him
out there.
Yeah. I like yelled for I was like sent a student like, go talk to head coach.
Yeah.
Go tell him that I have him. I'm fixing up his head.
Yeah.
You know how it happened?
How did it happen?
He's very proud to share the story.
Oh, good.
He was mad, so he threw his helmet.
Okay.
And I thought it bounced up back.
That's what I would think.
No, he grabbed his helmet to yell into it.
But what was he going to? I was going to say, what was he going to yell?
To yell cuss words. That's how he told the story to me. But he pulled it up to his head too fast, and the end of his helmet just hit him. Hit him right square in the forehead.
Oh, that's hilarious.
Yep. And I was like, man, I don't know why I didn't think of just gauzing you and giving you a nice headband.
Yep.
And I asked him later, I was like, do you want a headband? And I started pulling out the Powerflex. No, he was like, yeah, I want a headband. I started pulling out the Powerflex. He was like, no, you are not going to put that on me. You're not going to tape my head. And I was like,
you can.
It's a headband.
Yeah.
I do this all the time when I used to work wrestling.
Yeah.
All the time.
100%.
I'm just going to wrap it around. He's like, you're not going to do that to me.
Yes, I am.
And then he starts telling everyone that I was going to tape his head. And I'm like, you are taking this out of context.
Yeah.
So, we actually only have one more story left.
All right, here we go.
This one is about the eye.
It is by Brandee B. Working a soccer tournament, a kid got poked in the eye. His signs and symptoms were bleeding in the anterior chamber of the eye. I think we know where this is going. It was textbook hyphema. I had to explain to his parents that he needed to be taken to the hospital ASAP. They didn't want to at first, but I was persistent, so they did. He spent at least a week there.
That's crazy.
Yeah. He played for a developmental academy, so I wasn't responsible for the return to play. But I know he returned gradually and slowly to soccer. I did know initial management since it looked exactly like every picture of hyphema, so I sent him on his way. I believe his treatment was elevation of the head, and I'm assuming reabsorption took a couple of days. He had a patch on his eye when he returned to soccer.
Things like that are like
to the eye to return when you return to soccer. That's interesting.
Yeah, I don't know.
Interesting. That'd be tough to play.
I know, seriously. I always wonder about this because all these injuries that like are more monitoring than treatment.
Yeah.
What's the difference of not going? Like, I mean, I get that you have to monitor it.
Yeah.
But sometimes I'm like, what did they do for you?
It's the you're monitoring it in the appropriate facility.
Yeah, that's true.
Whereas if things hit the fan, right, there's a better response than if you're at home, things hit the fan.
Yeah, but why don't they just say like, oh, just come back?
Oh, because then you got to get back, right? Like response.
Call 911.
Yeah, well, the response time of that, and then the EMTs figure out what's going on, because no matter what situation, the EMTs are going to do their thing when they show up, right? They have to go through their normal thing.
True.
You can't just be like, hey, we came from the hospital, had a hyphema, right? They're still going to do their normal checks.
Yeah, because they're definitely going to believe you.
Yeah, exactly, right?
I had a kid who told me he had heat stroke yesterday, and I was like, you did not.
I was going to say, how many times have our athletes told us what's going on, and we're like, all right, I know what you're saying. Yeah. The words you're saying are not matching what actually happened.
Right.
Like the heat stroke.
Right.
No, you would know.
I'm like, did you have a kidney injury? Because I don't think so. Do you have any other eye, nose, face? I was going to include ear, but we had too many good ones.
Not really. I'm trying to... Yeah. I mean, I haven't really, lately now, because I'm doing team sports and sports with projectiles, haven't really had a lot of eye stuff, face stuff. Yeah.
Yeah.
Cool.
Well, we do every other episode as education or stories. This one was a story episode. You can find more story topics on our Facebook group that we plugged earlier, facebook.com/group/ATcornerPodcast. If you're not on Facebook, you can also, actually where we're more lively is on Instagram. And our Instagram stories midweek, every other week, we post some episode prompts for upcoming stories, so you can turn on post notifications for those, by the way. And that's when we post questions to kind of prompt you to get these stories. And every other episode we do as education. So education, some of them are CU episodes, some of them are interviews, some of them are different series that we're doing, like surgical series and stuff like that. So keep an eye out. If you would like to suggest an episode, just send us a DM or email us. And all the fun stuff is down below. Just make sure you scroll down to the show notes, see, connect with us, and I think that's all.
Yeah, that hits the nail on the head. That's right on the nose. Right on the nose. Thank you for helping it. Oh,
you got anything else?
No, that was perfect. Thank you for helping us showcase athletic training behind the tape. Bye.